The symptoms of tuberculosis include a bad cough that lasts 3 weeks or longer, coughing up blood or mucus, chest pain, weight loss, loss of appetite, weakness, fever, chills, and night sweats. When it's occurred outside our lung, the symptoms may differ.
Two types of TB are latent and active. Latent TB is contract when someone is infected with TB, but is able to stop the spread of the bacterium in the body. Latent TB can reactivate and cause an activate infection, so doctors recommend treatment to kill inactivate bacteria to prevent future infection. On the other hand, with active TB, the infected person is not able to fight off the infection, and the bacterium multiplies. That infection can potentially spread throughout the body via bloodstream, becoming extrapulmonary. Because bacteria multiply and not killed by individual, it can be spread to others. Once person got infected with TB, they also lead to two cases, pulmonary versus extrapulmonary. The majority of TB cases, around 67%, are pulmonary. About extrapulmonary TB, it mostly occurs outside of the lung, and it can be affect about 10 to 42% of patients and can affect any organ in the body. Here a picture that demonstrates what organ will be affected by it. Special immune cells, macrophage inject and surround tubercle bacilli. The cell form a barrier cell called granuloma that keep bacilli contained and under control. The granuloma result in small core in the lung where bacteria is walled off. And as if our immune system failed to keep the tubercle bacilli under control, the bacilli begin to multiply rapidly. All the process can occur in different areas in our body as well.
Granulomas formed by the lungs to prevent further infection will result in scarring. If the granuloma ruptures, fluid can leak into the space of the pleural cavity, leading to inflammation of the membrane that covers the lungs. Fluid will increase, causing shortness of breath and chest pain. If tuberculosis is reactivated, the bacteria can form cavities in the upper lobes of the lungs, causing progressive lung destruction. Miliary TB is disseminated TB. It refers to very small nodules throughout the lungs, which can be seen on an X-ray.
There are several ways that we can use to diagnose TB, such as TB skin test, blood test, AFB smear, and last but not least, X-ray.
Patients with active symptoms will require a long course of treatment involving multiple antibiotics. Antibiotics are taken for 6 to 9 months. Sometimes drug-resistant TB is contracted and stronger medications are prescribed to be taken for a longer period of time. There is a vaccine for tuberculosis called the BCG vaccine that is typically given to persons who have a higher risk of developing TB, such as children. It does little to interrupt the transmission of TB among adults.
For latent TB, the pathogen can live in the body of an individual for years, remaining inactive. For active TB, if you do not take the drug correctly, the germs that are still alive may become difficult to treat with those drugs. It takes at least 6 months and possibly as long as 1 year to kill all the TB germs. For the outcome, about 1/3 of the world population have latent TB, meaning they have the bacteria but have not fallen ill with the disease. They have a 10% risk of falling ill with active TB throughout their life. When a person develops active TB, the symptoms may be mild for many months. They can lead to delay in seeking care and result in transmission of the bacteria to others. People ill with TB can infect up to 10 or 15 other people through the close contact over the course of a year. A person's survival depends upon whether they have latent TB or active TB. The factors include whether the person is HIV positive or not, is diabetic or have other respiratory illness, his/her living environment, organ involved, and other associated problems.